I've been using NanoSALV within Siksika Home Care for approximately 18 months now. NanoTess is known very well in the community. Faces are recognized by community members. I choose to use NanoSALV because it decreases the longevity of wound healing. It decreases our supply use. It decreases the frequency of dressing changes.
Before NanoSALV, we've been running out of a lot of our supplies. We've been overusing our supplies unnecessarily. Now that we are using it, our inventory in our supply room isn't running out as fast. We're not using unnecessary products to a wound that doesn't need to be on there.
Potentially some of the wounds aren't having to go to the chronic wound in the city and things like that. When we have a couple of complicated wounds, NanoSALV has sped it up and we haven't had to make those referrals. So it's alleviating clients doing extra trips to the city. And that's an hour-and-a-half drive for them, and a lot of them don't drive, so then it's working around medical transportation, which can be a hassle as well, or just getting them there at all. I recommend it to everybody, even if they're Indigenous or not, but I think it would be in other Indigenous communities, if we could get it everywhere, then them having to go see specialists and doctors, I think that rate would be greatly decreased. And then the stress of having to travel overnights in hotels and things like that. Hospital stays could be prevented, possibly.
Prior to implementing NanoSALV into our wound care routine, it was difficult for our clients to be optimistic about their wound healing and the time that it took for their wound to heal. And after that, NanoSALV has afforded our clients the ability to trust us with their wound care. The decrease in frequency of dressing changes, decreasing their vulnerability to us having to come into their home, interrupt their daily activities to complete a dressing change, most of the time in very vulnerable positions and parts of the body. It decreases that. It allows them to be able to take control of their own health and be accountable for it.